Other work, I would, for me, I would do maybe some range of motion, some Traeger, a little stretching maybe to get that person maybe more adjusted on the table. Like if I saw some things, I might incorporate that. For you all, you could incorporate aromatherapy. Would you like a pillow underneath your knees?
That would be awesome.
So you want your person to be comfortable. And you're doing this a little bit. Do you get any body work? Any?
Like massage?
Mm-hmm.
I do. I love massage.
So I always just like to introduce my, hands and not like immediately dive into, the situation. So we start at the terminus. Palpate your clavicle. Sink slightly posterior. And whatever feels comfortable for you, your fingers, to be able to just let your fingers kind of dive in gently. And your direction is going to be a little bit like inferior, like sinking. And then you're going to do a medial stretch. And then zero pressure. Medial stretch. Zero pressure. Now, if you feel like you can, sometimes you can come in a little bit more medial, but you might feel like a pulse, just move away from that. And you can go out a little bit more lateral also, and you could do 5 also. And you could work that, you could do a couple times in each position. Now I'll come slightly above that, and I'm going to be in the neck region now, and I'm going to be in that cervical chain, that front cervical chain, and I'm going to be on the SCM and slightly posterior, like anywhere around that area. There's 200 lymph nodes, so it's not a specific, like, ooh, you're right exactly on it. So my direction is going to be a little bit posterior and then inferior stretch and then zero pressure coming up. And sometimes when you do that, it kind of looks like you're in a circle, and they call it a stationary circle. And I'm zero pressure. And I'm in this position 5 times before I move slightly above that. And I go slightly above. Same direction. Now, we all have different size hands, different size necks, so you may have to adapt. If I was working with someone where I couldn't get in to work on their neck, I would slightly rotate and I would work one side at a time, rotating. And I may only be able to get one or two stroke, I may be able to get only one or two positions. I may not be able to get three. So I could maybe just possibly get two positions. But you could rotate and do one side at a time. So, third position, right under the ear. Someone put some makeup on my hands.
I'm just zoomed in, so I'm only getting your fingertips.
Someone put some makeup
No,
on
in fact, yeah, I'm like...
Could I have my nails done?
Your fingers look 10 pounds heavier. No, just
No, imagine what my face looks like.
I'm zoomed in. I got the corner of your mouth and her fingers. That's pretty much it. Yeah, it's... Just so we can see
now,
how the...
see how I'm getting, like I'm finding that rhythm. Mm-hmm. And so that when you get into a rhythm, it becomes very relaxing for that person. Now I'm going to go back down. You could start from the beginning again and go up, and then you could start from the beginning again and go up. But I just go back down and then I go up again.
But you don't go back down to the terminus.
I do.
When you start again?
I go back to the terminus, and then I go back up.
Okay.
And then I'll go back down. I want to make sure of all the areas that I drain, that I really get this moving. Because this is the main.
Okay.
It's got to be kind of difficult to try to do any of this on yourself.
Oh, it's easy.
It is?
Mm-hmm. Yeah.
You would just have a different angle because you're reaching up, but you can
We'll
just...
go over it next week.
Okay.
We'll go through a session and I'll help you. And I'll talk about, working with your breath also.
So I can get with that
That's
angle.
really, really important. Working in that axillary area and working around the breast. So I'm going to go back to the terminus and sink in gently and
Now you go up, do you work your way back down? Or do you go up and then go back to the...
well, what you can do is you can just start from the beginning and go up again.
Okay.
It will be easier for you to remember that, to go back down, and then
where you're at.
Okay. Yeah. So I may do that several times, but in the interest of time, I'm going to go now to her back chain of her neck, and that would be on the trapezius, and my direction is going to be anterior and medial. And it's that same idea of stretch that skin and zero pressure. Don't break contact with that person. Just go to zero pressure. So I don't do this. I don't disengage from my person. I stay engaged, I build up a barrier. And really, when you're practicing on yourself, if you just lightly would lay your fingertips in this area, the lymph would want to move you. You would be moved by it. That's how gentle that is. And even like when I'm teaching, I'm doing it a little bit heavier to show more, but sometimes I'm so light pressure that you're not really even seeing a movement sometimes. It's so I'm on the back chain now. So I would stand up and I would come this way. And if you look, let me show you this. If you look, see how that is flowing? See what my direction is going to be when I'm in the posterior neck? Where am I going to be bringing that fluid? Where am I going to be stretching that skin to? Anterior. I'm going to be, when I'm on the neck, I'm going to be almost like a choo-choo train. So I'm here on the trapezius, and then I come and my fingertips are almost touching. And so I'm going to have an anterior and then an inferior, anterior and then down, and then zero pressure. Now I'll show you over here, and I'll show you over here. If I was doing one side at a time, my hand would be, I'm on the trapezius, my hand would be slightly above that. And so my direction is going to be anterior stretch and an inferior arc.
Okay, so it's all right, kind of like an upside
remember,
down
you're
U.
always going towards. So I'm coming forward, and then I'm going, and it feels really good, doesn't it?
It almost feels like you're doing like a circular motion.
Yeah,
Right.
it's like a U.
And it
upside
does
down.
look like a stationary circle, but remember, I'm zero pressure. I'm just
When you're at
coming
the bottom.
back. So I'm going,
You're really kind of going back and forth.
anterior,
but, yeah.
inferior, and now I'm zero pressure.
When you go back down is when you're zero pressure?
No, I'm going anterior, inferior, and now zero pressure. I'm springing back to my original position, just like that. And then I go slightly above that, and I do that same thing.
Move her hair so I can see.
So it's almost like when you think about a choo-choo train, how it would go like that.
Yeah.
It's almost like that.
Now your thumb's there. Is your thumb doing any pressure or just there because it's there?
Yeah, my thumb is working too. My whole flat of my hand is working when I work like this. And I actually like to do, when I work the back of the neck, I actually like to work one side at a time. I personally like that. You can work both at the same time, but I feel like that's an area that really needs work for most people, and especially for this young lady here, because she's got neck issues. So then my third position is going to be the occipital area. Now remember, if you look on here, the occipital area, the posterior head drains to the occipital nodes. So when I'm in that area, I'm always focused on really getting that fluid moving in that area, because that's an area that really gets a lot of tension and stress. You've got deep cervical muscles that attach onto that occipital ridge. And it's a really...
I serve and bartend, so
it's more, you know, you're, like you can even see, like you see how her head's being pulled, the chin, how it's being pulled over
To the left. Right.
Yeah, to the right side, how it's,
I'm not
you know,
aligned.
so you can, no. But it's you know, it's just, it's the way that she's working, using her body, you know, and you can see, you know, that it's pulling over there. So now to show you what we were doing. So I'm on the trapezius. Now if we wanted, remember, if we want to drain both sides, we're going to be like this. And we can do that, but I like to just rotate the head, and then I start closest to the trapezius where I started, and then I move slightly above that, and my direction is going to be anterior and then inferior and zero pressure. So that does look like a circle, but remember, I'm just zero pressure coming back. So I'm coming anterior, inferior, and then zero pressure. And I'm 5 times in that position. Now, when you get a palpatory skill, you can feel areas that may just feel like there's more congestion, that you're not quite getting the movement that you want. And you might want to be in that area a little bit longer. You know, you might want to do 2 passes or 3 passes, you know, up and down, you know, back and, you know, do several. My third position is that occipital ridge right there. So I really want to get up in that area, that soft fleshy area, and you can feel it in there. And that's where that posterior, those nodes are, the occipital nodes there, and you just drain right there. Anybody that has any neck issues, this is a great place to really work. I'm going back down now. So I could do that several times. I do more in, I do some really intricate work, you know, really in that for these vertebrae, where I do some work. But for what we're doing, so I might do that several times and come back to the trapezius and then flush out those nodes right up onto the trapezius. There. Now I'm going to go to the submandibular nodes, and that would be under mandible. I'm going to start at the angle of the jaw. And you saw when he was working, he did sort of a twist, which you can do that if you want. I just sort of kind of gather up and just, I like to kind of just move it, use my fingers like this. And I'm going in a posterior stretch direction and zero pressure coming back. And moving in. So what lymphotome am I working with now?
Postmandibular something, isn't it?
Mm-mm.
No.
I'm in the submandibular node area, but what lymphotome drains to this area? Look on the chart. Where am I going to go after I've worked on these nodes?
This area?
Just that area right
No.
there, or what area? Show me on there. Inside the triangle is the anterior lymphotome. Okay? That's what's, so this is really important to understand. Look at that picture right there. Okay. The inside of that triangle is a lymphotome.
Okay.
And a lymphotome is a quadrant or area that's being filtered by the same nodes. So when I work this submandibular area, I'm preparing the inside of that triangle. See all the vessels that are going towards those nodes? I'm preparing that. And what I'm doing is I'm working in the node area. And so the resistance of the flow in this particular lymphotome that's being filtered by those nodes, I'm breaking that barrier of resistance, because the greatest resistance to your flow of lymph is in the lymph nodes themselves. That's where things really slow down. So these lymph nodes are filtering that anterior lymphotome of the face. When we go to the lateral lymphotome, that's when we're on the parotids. And so outside of that triangle and in between the anterior and posterior head is the lateral lymphotome. Do you see all the vessels, what direction they're going to? Where are they going to on the lateral lymphotome?
Down.
They're not going up.
Occipital.
Where are they going? What's that? That's your parotid. That's filtering out that lateral lymphotome. So you see, this is where your knowledge of understanding lymphotomes and watersheds, what direction, that's going to tell you what direction you're going to send the fluid to, right?
Right.
So you're helping it along. So the greatest resistance is in the nodes themselves, so that's why we always start in the node area and then work away. So you see, when I'm here, I'm working those nodes. Then I'm going to come slightly above. I'm going to follow this nasolabial line down. I'm going to start right there, and I'm going to drain. And my direction is going to be a little bit lateral and inferior, or posterior and inferior. And it looks like a circle, see? But I have zero pressure. I don't do this. I go one direction and then no pressure. Down, no pressure. And that's what I'm doing. Now, if I wanted to, I could move in medially and I could work and really work this whole area. When you see him on the video, he's working here, then he's working here, then he's working here, 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 and here. So let's say I have a face and there's a lot of lines, like on my face. I might want to really do more intricate work around that area. So once you get the routine down, practice the routine, and then you're like, well, I know what direction it's going, because what you're really doing is you're really facilitating a lot of healing in that tissue when you work those areas. So you might want to go in and work more around that area. When you're on top of the lip, it's just a straight stretch. And I'm going to start out and work my way in. So I'm going to do a straight stretch. Move in.
Are all 4 of your fingers doing something, or just the 3?
All 4. And the difference between the technique that I learned...
It's crazy. It just feels like you're like stretching. I don't know. Never felt that before.
And then I'll come up beside the nostril and work. And I use all my fingers, but I have small hands, so I can do that. So you just got to figure out what's comfortable for you. This area feels really good for sinus sufferers.
Mm-hmm.
It just feels really nice. You're moving things. When you get up on next to the bridge of the nose, it's a straight stretch down. And then when I get up onto this top of the bridge of the nose, I kind of work in a little bit midline and inferior. And then I'm going to go back down. Now I might do that several times, especially knowing, sinus issues, but I'm going to come back and I'm going to drain the submandibular. I'm going to rinse those nodes out again because I've just work that area. So you just come back and do a little rinse. Now, if I wanted to, I could go back down the cervical chain just to rinse that out too if I felt like, you know, I might want to go down one more time to just get things moving because I did that, so I might feel like I want to do that. So you could do that too. Now we're going to be on the lateral lymphotome. And so we started the parotids, and as you can see, it's on the face, so it's not on the neck. And you can see what the location is, right up there. Point to the parotids for me.
I'm freezing.
Cover up.
Ooh, thank you.
That whole area is the parotids right there. So that's where we start. And when we're on the lateral lymphotome, our direction is posterior, inferior. Does everyone understand that direction? So let me show you. On the parotids. Now, you saw that he used his fingertips more. I like to use my whole hand. And so posterior, that way. Inferior that way, and then zero pressure. So it looks like a stationary surface.